Rhinoplasty is a plastic surgery procedure which is addressed to correct the shape of the nose. Not only just the shape, but also it improves the function of the nose. People come to us not just for improving the cosmetic look of the nose, but sometimes these people can have problems with breathing. So when this problem with breathing is there, after doing a lot of investigations, we come to know that which are the structures which are causing the breathing issue, and we address these issues even before doing a cosmetic correction of the nose. So all these procedures which help in reshaping the nose and doing a corrective surgery are collectively termed as rhinoplasty. The question which is commonly asked is, can all the techniques of rhinoplasty, can they be combined into one single operation? Yes, these can be combined into one single operation. What standardly goes into rhinoplasty is correcting the height of the nose. So the height of the nose can be improved, number one. The second thing which can be corrected is also the width of the nose. Patients complaining of the enlarged width, which makes them look weird, or they want to seek a correction. So the width also can be addressed in this operation. The third component which can be addressed in rhinoplasty is the tip of the nose. So this is called a bulbous tip. Patients may have rounded tips, they may have boxy tips, all kinds of different shapes, but these can be corrected and the tip can be made to look much better. So this is called a tipplasty, also combined in a rhinoplasty. The fourth component is the alar base, the lower half of the nose where the alar sits on the cheeks. So this is called a alar base reduction. This is also addressed in a rhinoplasty. Now apart from these four procedures, there is something called a septoplasty, where we correct the position or the shape of the septum. Usually the septum has to be sitting like a curtain in the midline of the nose. So when we do a rhinoplasty, all these procedures are addressed in one particular session. Of late, our patients ask us what is the least invasive method of rhinoplasty. They ask us whether we can, doctor, whether we can get it done by a closed rhinoplasty or a open rhinoplasty. Now this is a very good question to be answered, because the closed method of rhinoplasty, the incisions are all placed inside the nostril of the nose, where one cannot even see whether the rhinoplasty has been done. So with minimal incisions from the inside of the nose is opened up, the corrections are done, and the nose is sutured up from inside. So this is a closed rhinoplasty. Contrary to the closed rhinoplasty is the open rhinoplasty method, where the whole envelope of the nose is opened up from below the lower half of the nose, typically on the columella, and this incision extends onto the nostril rims, and the entire skin is degloved, or it is open to expose the underlying structures. So when I say that it's the underlying structures have to be opened, we correct the height of the nose, we address the width of the nose, the tip is corrected, the septum work can be done, even the alar base work can be done in a rhinoplasty. So all this is open method of rhinoplasty, where the skin is opened up and the work is done, and then it's sewn back into place. So two methods, closed rhinoplasties and the open rhinoplasties, both can be done. Depending on the patient wants, we can do either of them. Which patients can be benefited by a closed rhinoplasty? Okay, if the corrections are very minimal, if they involve only portions of the tip which have to be addressed, or if only the dorsal bridge has to be addressed, then the closed rhinoplasty is a good technique for us to choose, so that the scarring is minimized and the patients can go back, can heal earlier, and they can have a quicker recovery. So minimal corrections of the tip of the nose and on the dorsum, it's good to choose a closed rhinoplasty. On the contrary, if the patients have multiple requirements, the patients have a functional problem, the patients have a very wide tip, the patients have a very crooked nose, it's a very broad dorsum, and which has to be corrected, multiple complex things which have to be done, it's better that the surgeon visualizes what is there underlying, so that the surgeon can, with all his experience, can sew up these parts by actually visualizing the nose and then repairing these and closing back the skin annulum. So this is the open method, where it is usually done for very complex corrections or even extensive corrections. Many a times in our consultations we get patients bringing in pictures of actresses, celebrities, and the first question they ask us is, can our nose look like this particular actor's nose, maybe an actress's nose whom they are very fond of. I want a nose which looks like Sridevi, one particular patient will ask. And somebody may ask that I want to look like a Hrithik Roshan's, I want a Hrithik Roshan's nose. The short answer to all this is no. That's simply because every nose is unique and peculiar to that person. So whatever the configuration is, one may change or alter to suit the rest of the face, but you cannot make the nose exactly look like somebody else's, because that's the USP of that particular patient. You cannot alter it, you cannot, no matter how much of work you do, you cannot make it look like somebody else's nose. All we can do is to improve upon the features and make it look much more aesthetic. So it's wrong on patients' part of themselves to come and tell us that I want to look like this. So there are times when we actually reject such patients. We just say that probably the patient has too much of fixation or obsessive compulsive disorders seeking such noses. So in these cases what we do is we step back and we make a psychiatric assessment so that we don't get into problems, the patients and us don't get into problems because of undesirable effects. Patients seek our consultation for broad noses, and some patients may even have good looking noses, but they want even more sharper noses. So sometimes this is a very tricky situation where the patient's expectations are too high, and this is where, as plastic surgeons, we evaluate these noses. We see whether there is existing functional deformity in the inside of the noses. Sometimes the internal nasal valves by themselves can be blocked or they can be closed. We order CT scans to see the internal side of the nose, and we assess whether this patient is a suitable candidate for narrowing the nose. Because when we narrow the nose to a particular extent, beyond a particular extent, what happens is the internal air passage which is there in the patient, that can get overly narrowed. So we must be careful, and even before the surgery is undertaken, we tell the patient, look, if this is your demand and the CT scan is showing that it cannot be compromised beyond a particular limit, we tell the patient in advance that only a certain amount of narrowing can be done, and beyond which we cannot address the corrective narrowing, simply because the patient's internal architecture doesn't permit us to do whatever the patient asks us to do. So we have to draw a line as plastic surgeons and clearly explain to the patient what is possible and what is not. Costigan rhinoplasty, this typically is dependent on the nature of surgery. Now, in our previous videos, we have shown you what exactly goes into rhinoplasty. It can be a simple tip work, or it can range from the entire correction of the entire nose, which corrects the architecture, which corrects the bridge, which corrects the alar base, and which also addresses the functional problem. So it can range from very minimal surgery to an extensive surgery. Now the cost is actually dependent on how much of work goes into a rhinoplasty, what is going to be the length of the stay, how complex is the nature of the surgery. So all this depends, and even depends on where you're getting it done. If you're getting it done in a let's say in a nursing home or a place where the overheads are not much, a cost of rhinoplasty could be considerably less, vis-a-vis a place where you're going to a corporate hospital where the overheads are much higher. Now you will also have to look into the safety of a particular place. So generally what happens is the corporate hospitals, the safety mechanisms, the teamworks, the critical care, everything is working for the patient. So when such infrastructure is being thrown in for the patient, the costs are bound to shoot up. So it's a general rule that once you choose your hospital can be a nursing home kind of a setup, or it can also be a standalone private hospital which is being owned by a particular surgeon or a doctor. So these are the kind of setups where the overheads are less and you can expect the rhinoplasty surgery to be cheaper. The same thing if it's being operated in a corporate hospital or the other bigger hospitals, there the cost can be significantly more. Now typically a tip plasty or a single procedure or something which is less complex can range from 50,000 to around 80,000 depending on the hospital setup. Now this is for all non-complex surgeries and straightforward surgeries, but for correcting the entire nose and for doing an entire internal correction, the range can be from 1 lakh to 1.5 lakhs, or it can even go up to around 2 lakhs. A very typical question asked by our patients is, can my broad tip be corrected? And most of these patients have a very thick skin. So this is a typical South Indian skin, and we encounter a lot of these patients seeking corrective surgeries for these kind of problems. Now the answer to this could be yes and no, depending on the thickness, depending on the underlying structures, depending on the underlying cartilage thickness and the anatomy of the nose. Now when the patient has very thick nose, no matter what we do, may not show up on the exterior. So this is a red flag for a plastic surgeon to say that, look, I cannot really improve your nose. But to the contrary, sometimes the cartilage is very thick and it can be manipulated, it can be shaped, and even the structures of the skin can be trimmed to a certain extent once we preserve the blood supply and we find it suitable for doing the corrections. So in such cases we tell them, yes, it is possible to undergo the tip surgery and you may have certain results, but the results cannot be promised like we do for other surgeries where we are little guarded about the correction and we clearly explain to the patient, this is as much as what we can do, and beyond this it's really not possible. So only when the patients are in agreement with us, we take these patients up for the surgery. At times we get patients who have undergone a rhinoplasty and who come to us just because they have not liked the result, or just because something has not settled down after a particular surgery, and they come to us seeking a corrective surgery. Now we try and explain to these patients that typically a rhinoplasty surgery, the result could be expected in probably 3 to 6 months of time. So a patient must wait for almost 3 to 6 months for the result to settle down. A lot of times after rhinoplasty, there is a lot of swelling which sets in. So this swellings, it masks all the work what we have done, and what happens is one may not appreciate whatever we have done. So patient may be initially happy, but as the swelling comes down, as the massages keep getting done, the anatomy or the underlying topography starts to show up and the changes starts to show up. So it is wrong on the patient's part to hurry up and seek a corrective surgery immediately after undergoing a previous rhinoplastic surgery procedure. So we tell the patients, we make them understand that swelling is a normal part, it's a part of the post-operative process, and that they must wait, they must be patient, including the surgeon who's done it. So once it's given time for the swelling to settle down, the results can be appreciated, and certainly these patients may not require a corrective surgery. Another inquiry which we plastic surgeons keep getting, or patients come to us asking, what is non-surgical rhinoplasty? Non-surgical rhinoplasty has been happening for the last couple of years, where we plastic surgeons inject hyaluronic acid under the skin to get the desired effect. Now, where does this liquid rhinoplasty, what can it address? Now, this typically addresses those conditions where patients have a low-lying dorsum of the nose. So they might be having saddle noses, or they might be having noses which are not prominent, where the height of the nose is just inadequate. So these are the kind of noses where we can address by injecting a filler directly under the skin of the nose to actually increase the height of the nose. So it is just an office-based procedure where it takes hardly around 10-15 minutes. It doesn't require any anesthesia because the filler itself has anesthesia within, and all it takes is prepping the skin and understanding the patient what the desired effects are and what the patients need, and then we inject the filler, and there you go, the patient has a nice, smooth, sharp looking dorsum, and that's all they want. So liquid rhinoplasty is a wonderful technique. It can be done as an office based procedure. People can have it during their lunch hours. It's as simple as that, and it's not as expensive. It is just a filler, so it's very much doable. But however, not everything can be corrected with the rhinoplasty. You must understand that only the height of the nose can be adjusted, and not the other things which go into a standard open rhinoplasty.